Have you been postponing a hair transplant procedure for years now and wonder when will you finally get that hairline that you always dreamt of? Or did your hair transplant surgeon refuse to operate on you as he thought that you were too young to get a hair transplant done? If so, I completely understand the turmoil that some patients might be in, as they might not be understanding the importance of age in the planning of a hair transplant procedure. In this video, I, Dr. Akanxa Bhatti, am going to discuss different case scenarios in different age groups that I encounter in my daily practice. Let me begin with discussing about hair restoration at a young age. Young men with receding hairlines end up feeling emotionally devastated, shying away from attending lectures at universities or mixing up with a group of peers could be some telltale signs that your receding hairline or your balding crown could be impacting your lifestyle. When a young man, say 21 years of age, walks into my clinic, I understand just how important his hair is to him at a stage when he aspires to achieve many milestones in life. But in spite of a grave need for a hair transplant, is it right for a doctor to succumb to the patient's persistent requests to go ahead with the procedure? Why do doctors ask young patients to wait till they are at least 25 years of age? When hair transplant surgeons examine the scalp of a patient during a consultation, they form an idea of the future pattern of baldness and also determine whether the procedure would be fruitful to the patient in the long run before he invests his precious time and emotions. Often, patients in the age range of 17 to 24 have not yet developed a stable pattern of baldness. This means that the hair in the donor area at the back of the head still shows signs of progressive baldness, such as hair thinning. If we were to transplant the hair which is bound to vanish within a few years, the patient would be left even more devastated than he was when he wished for more hair before a hair transplant procedure. He might end up losing the hope he had before the hair transplant. So, the best option for a young patient is to hold on to this hope and to postpone the hair transplant procedure to the year he turns 25 or when he develops stabilized baldness. The results of a hair transplant done in individuals who are 25 years of age and above are remarkably more successful than that of a hair transplant performed in a person who is less than 25 years of age. Meanwhile, after a proper counseling session and history taking, these patients can be kept on medications such as an oral DHT blocker or topically applied minoxidil if there is no underlying medical condition that might concern the doctor. I would again like to mention here that DHT or dihydrotestosterone is the main cause of androgenetic alopecia in men, or in simple words, genetic baldness in men. To all the adventurous young individuals out there, I request you not to explore the effects of these medications on your hair without consulting a doctor, as you might not be the right candidate for taking these medicines. Now let's move on to the next scenario. If we were to go ahead with a hair transplant in a person who has, let's say, just turned 25 and shows no signs of progressive baldness, the hairline cannot be lowered to the extent that I would consider lowering it to in a patient, say 35 years of age, with the same grade of baldness. This is due to the fact that when he turns 35 himself, he might end up losing his hair and might desire a hair transplant at that age, for which the donor reserves need to be preserved. Also, an excessively lowered hairline might stay in place, but the area which was not operated on, that is, the area which was not the recipient area, might end up balding in the future, which will not be aesthetically appealing. Therefore, proper positioning of the hairline is crucial for good cosmetic results even years after the surgery. Let's take another scenario into consideration. A 63-year-old man, still young at heart, can get a hair transplant done whenever he thinks is the right time to go ahead with the procedure. The only situation which would not make him an ideal candidate would be if he has an underlying uncontrolled medical condition. In that case, his health needs to be optimized first by the doctor who diagnosed him with the medical condition in the first place. After all, a hair transplant is a medical procedure. The good news here is that there is no upper age limit for getting a hair transplant done. I have noticed elderly patients who get a hair transplant done at a later stage in life start incorporating new hobbies into their lives as their personality completely transforms. I hope you found this video helpful. Please subscribe to my YouTube channel and also like this video if you think it was informative. Also, do not hesitate to ask a question in the comment section below. Thank you for watching.